if you have to carve away somebody's teeth, then you overcorrected, So, I mean, the braces were not, I don't think a huge factor in the high maxilla. It didn't help because, I mean, you're still developing as a boy. You're still developing from your teenage years all the way up until mid 20s. So the braces didn't help. Obviously, the high maxilla was there to begin with, and you could tell going through my growth spurt that it continued to grow upward. And during that time, you can see with the pictures that the nose very gradually goes into this position. So, he takes off the braces and he carved away at my fangs, which is it's a bummer because that's actually seen as a very attractive quality in men, is having those fangs, and he shaved them down to such a degree that every now and then, my mom, she was just like, "Did you chip your tooth or something?" And I'm
Wow.
like, "No, the dentist did that. You see that?
He flattened it.
He flattened it."
Yeah.
So I mean, I can't believe some of the things that orthodontists will do to kids. And so that's a third. What I'm getting at is that's a third professional. That's a third person with a medical license who didn't look. Nobody looked until I saw this YouTube video and put my finger in there. I was like, holy shit! There's a whole issue right there.
hmm
And I mean, go now that I'm 35, I'm starting to have issues with plantar fasciitis and other things that are sort of related to poor jaw health. Because I had learned from your videos that that these facial asymmetries travel throughout the body. So it starts with the jaws, and then the shoulders, the neck, the shoulders, the back, the hips, and then the feet. So there's definitely neck problems, shoulder problems, hip problems, and feet problems as a result of not mewing. You know, uh, uh, you know, throughout the span of my childhood. Um, so yeah, I'm dealing with some pretty severe issues, from that. But yeah, I mean, the main message was that if you're thinking about getting a rhinoplasty, to correct airway issues, check that first. Because that would, oh my God, I mean, I mean, I essentially missed a whole year of school. I never recovered from that. It's just like, I just basically just became a shitty student after that because I was so far behind. I gave up.
Yeah, and a lot
You
of
know,
people watching might not realize that in the early 2000s or late 90s, whenever this was, there was no Zoom, there was no remote learning. It was like if you weren't in school, you were not seeing the action. You were out. So
basically, yeah.
yeah.
Mhm.
So you just were like completely disconnected from the curriculum that your
Mhm.
classmates were going through at that time, and I'm sure that had downstream effects on your, your college experience, if any, and
Mhm.
your confidence as a well-to-do professional who was embarking on a career. You that probably stunted you in a lot of different ways.
Yeah, absolutely. Absolutely. Yeah, I would, I it's hard not to fantasize about how differently my life would have panned out, if somebody would have just looked, if somebody would have just said, "Oh, he has a very, very narrow maxilla, and if we fix that, he'll be able to breathe through his nose, and that will give him marked improvement in his athletic abilities. He'll be able to sleep better. Those ADHD like behaviors that he has would would reduce, and so I mean, things would have panned out so much differently if somebody just gave a shit, just
Now,
cared enough
something
to look.
And when you say cared enough to look, for people just listening, not watching, you keep pointing to the roof of your mouth, but you're talking about they didn't notice your underdeveloped jaws and they just focused on the nose, and that was the key. They didn't see the underdevelopment of your arch as the root cause of everything you were suffering.
Exactly. Yeah.
hmm
Yeah, which I
hmm
mean, so I guess that's another thing, I'd like to leave the audience with is, and I'm sure they already know at this point, in this age of information, don't trust somebody just because they have a medical license. Because I mean, this should have been so obvious, especially
Mm-hmm.
after the first failed surgery. That and I recently went to a doctor. So here's another thing. Here's another reason why you shouldn't trust people with degrees, just because they have degrees. So uh, I'm interested in this whole thing with expansion. So I'm starting to get abrasions on my teeth. I have to get regular fillings about like once every few years, because what happens is my bite is too tight. So just by chewing, it's like grinding. It's like somebody who's grinding their teeth aggressively. So I don't grind my teeth, but because my bite's so tight, it's creating abrasions on the top
Mm-hmm.
of the bottom teeth. So I regularly every so often have to go in and get fillers. So they're correcting that. They're like, he's just a grinder. So they're they put fillers in my teeth. And so this time, after being armed with information from your channel, I was like, hey, I think my teeth are really narrow, and that's the cause of the issue. And so she looks inside. She's like, whoa, like you have a cavernous, roof of your mouth. Your maxilla is like a cave. Like definitely, yeah. You should definitely get expansion done for that, and that would fix the abrasions that are happening on your teeth. So it's only when I mentioned it is when they considered it. And but
Mm-hmm.
just as a side story to this whole thing, in that same visit, the dentist didn't notice it, but the dental assistant is taking a look at my X-rays, right? And he's just like, "What's that?" So he points at this thing. There's a piece of metal in my mouth that nobody noticed. So when I got my wisdom teeth pulled, was check another box for bad jaw health, right? I had my wisdom teeth pulled at 22. When he pulled my wisdom tooth off, part of his tool broke off, and it's just been sitting in my mouth for a decade. And I've been to this same dentist year after year, and nobody mentioned it or noticed it. I don't know if they were just trying to protect the dentist who took out, my wisdom teeth. They're like, oh shit, maybe we shouldn't talk about that. But or they just don't look enough. They're seeing hundreds of patients a week, and unless you bring it to their attention. So I brought it to the nurse's attention when she came in, or the the dentist, that, hey, your dental assistant found something interesting. There's a tool in my mouth. And she's just like, oh shit, well, I guess you better get that removed.
Mm-hmm.
So I mean, we're talking about just, I mean, I've been the bearer of bad luck when it comes to incompetence with people
Yeah.
who have a medical license. So you know hopefully your audience takes that as a big warning, to consider that, you know make sure that you're bringing things that should be considered to the table, because these um the surgeons, like I said, problem with the nose, they go right for the nose. All I would have taken was just, especially after the first failed surgery. I mean, there was a precedent for failure. So you would have thought, hey, well, I don't want, the surgeon would have been like, well, I don't want my procedure to fail. So let's look a little more closely at this. And
Yeah.
he didn't.
Yeah. Yeah. Yeah.
You know?
Yeah. Well, you're certainly not the only one who's had the root cause of their symptoms um, misdiagnosed, missed for decades at a time. A large constituency of my viewers is in the same boat. And hopefully, some of the younger ones experiencing the things you experienced as a 16-year-old and younger can learn from your lesson